again, a few panelists talked about the role of the FTC guides. They provide very useful criteria, probably in a couple of areas. One, the idea of sponsorship. The FTC said, again, that the brands, the advertisers, the agencies are responsible for the conduct of the agents, of the speakers, of the bloggers. And the FTC also said you have a responsibility to train and to educate these people. And two, you have a responsibility to monitor. But it's only if those are kind of agents of the advertiser or the agency. Only if they're sponsored. Which is in a way a very common sense principle, because it's like agency law, was somebody mentioned today. Because if you work for a company and you're driving to a business meeting and you get the car accident, not only you're liable, but your employer is liable. It's an issue of agency law. Same kind of concept here. The FDA can do that with respect to controlled, sponsored communications. Sophisticated consumer. I really think this is important. I really think this is important. The FDA is trying to protect consumers, like the FTC. They're trying to protect the ordinary consumer from being misled and being deceived. Okay. But we're not dealing with an ordinary consumer when they go online to try to get information about their health. I think somebody mentioned it today. This is not an impulse purchase. When a consumer goes online to buy something like a car, clothing, jewelry, what have you, you could let your emotions say, yeah, I really want that. If I buy this clothes, I'll look more sexy. So that's kind of very impulsive, and you're therefore more subject to the persuasion of the advertiser. Healthcare is a different animal. It's products you ingest. It's treatments that affect you and your head, your mind, your body. Your family gets in. There's economic considerations. So therefore, the class of decisions that you make in the healthcare context are fundamentally different. So therefore, when you're online searching for information about products or healthcare, you're going to be a lot more actively involved. And you're not going to be subject to this kind of impulsiveness you might have under normal retail products. So I think that should tell the FDA very clearly that, this idea, like, I'll be critical. There was a woman who was saying, one click away is one click too many away, something like that. Well, that's not the reality of the way this type of ordinary consumer operates. And again, I've asked the FTC this question. You have to be very careful in your regulation. Are you trying to protect the reasonable consumer or the least sophisticated consumer? Because if you're trying to protect the least sophisticated consumer, you'll bend over backwards and over-regulate to be sure that the idiot who's, doesn't even have a second grade education can understand it. And so I think the FDA needs to ask that same question. We've got a very sophisticated, engaged consumer in this industry. So therefore, I think that it provides us, advertisers and the brands, it should provide us more discretion. We're not dealing with a bunch of idiots. Social media policy. I'm working with a lot of companies right now on the FTC piece about what do we do to comply with the policy requirements of the FTC. I think we're going to have to get our clients, and including agencies, are going to have to develop a social media policy that minimally talks about disclosures right now. It's going to have to talk about education. It's going to have to talk about monitoring. And I think you heard social media policy used at least 3 or 4 times. Again, it was to get the panel, give them a comfort factor that, yes, companies are ready to stand up to the plate, will be regulated, we want to do the right thing, we're going to be good corporate citizens, and we'll adopt the policies that should make you happy. Governmental relations, number 10. There was a couple of times where they were saying that there should be interagency cooperation. That if you've got the whole wide world of the internet, and there's snake oil salesmen, and there's a whole bunch of fraudulent activity, a couple of people say we need more resources to try to go after those guys. Again, there could be a cooperation between the FTC and the FDA and the Department of Justice. So again, that is, to the extent there's a fear that we need to overregulate because of the bad guys, you don't need a darn, bulldozer to take care of what a pair of scissors can do. Finally, uniform standards. We've heard about logos. We've heard about hashtags. I guess there's needs to be, and the FDA can do this very simply because it's the go-to agency, develop a language, a symbol, uniform standards. It's kind of like when we're used to the idea of when we get food, we look at the labeling stuff. There's a sense of uniformity, and that's very useful for the consumer. And we kind of look for the box with the calorie information and carbs and all that. When it came out, it was pretty novel. It was new, and within a matter of just a couple of years, we all got used to it. Again, it's like a common language. It's a common way to get consumers comfortable, in understanding what's going on. Easily, somebody could come out and say, here's the uniform logo or symbol that you put in a tweet to show that it's sponsored. So again, the FDA can just, given their position, they can adopt uniform standards or a logo so that here's a little symbol on a sponsored link that if you click on that, the consumer will go to the risk information by the pharma company. I thought that was a very good suggestion. It's a good solution. Final point is there were several questions by the panelists. It wasn't anything earth-shattering. They went from amazing simplicity to what is a link to a question that they asked the Johnson & Johnson folks after their presentation, and they said, we are committed to providing accurate information and getting it to the consumer quickly. And the director then looked and says, well, how can we help you do that? So it was interesting questions. My only surprise when they structured the hearings, what the FTC tends to do when they do these kinds of workshops or hearings, they'll have panels. They would have taken each of the 6 questions and had a panel on accountability. And then they would have had a panel or issues just dealing with monitoring. And then they would have a panel just dealing with adverse events. And they would have chewed it out in those chunks or buckets of topics. Here, people are just going up and talking about everything. Tomorrow morning will be different. But that, just by the mere structure, sent to me the idea they just wanted an education of social media 101. They wanted to hear it from first grade on. So anyway, those are my thoughts. And questions, discussions.